What's up, y'all? It's Celeste, and I had my double incision top surgery with Dr. Garramone on October 10th, which makes me now 2 weeks post-op. And so this is my little update about how I'm doing, and then I'm going to show you my chest and show you what I'm looking like at this point. So I've been doing pretty well. I've been home for almost a week now, and I have made a lot of progress in that time. First of all, just with the amount of energy that I have and strength that I have, ability to do things around the house. I still need a whole lot of help with stuff, but I feel like every day I'm getting a little bit more mobile and a little bit more able to do different things. So that's really good. It's still intensely frustrating not being able to do all the stuff that I'm used to doing. It's been really difficult, especially the first couple of days. It was super frustrating because I'm so used to routines and so used to doing things in a certain way. And having all that kind of uprooted and needing help with everything was just really, really frustrating and just kind of overwhelming. So that was difficult. It's getting a little better and I'm getting more used to needing help with certain things. And then at the same time, I'm able to do more things all the time. So it's kind of just like this progression of partly getting used to it and then partly not having to get used to it as much because I'm able to do more stuff. But it's still very frustrating. I knew that it was going to be frustrating, and I knew that I was going to have to keep myself from trying to do too much because I don't want to stretch my scars, I don't want to do anything that's going to hurt me or anything like that. And I expected for that to be more of a self-discipline thing, which it kind of is. There is definitely an element of it that's just don't do things, don't push yourself too hard, don't reach for things that you shouldn't be reaching for and stuff like that. But what I didn't really think about so much was how much of it is actually not really about you choosing to do something or not choosing to do something. It's more like you just don't know what's too much and what's not, because the way I was kind of thinking of it was okay, you shouldn't reach past a certain point, and so you might just get impatient and do it anyway. But what it actually is is it's not always a matter of it's really difficult to reach here, so therefore it's too much. That's kind of obvious, but then some things, maybe you can do it, maybe it's manageable to do it, and maybe it's good for you to kind of be pushing yourself to do certain things that are like that. But then on the other hand, maybe it's not, and you just don't know. You don't know what is pushing yourself in a positive way and trying to be able to do more things and heal, and what is kind of pushing yourself too far. So it's just a lot of it is less obvious than I thought it would be. I thought it would be more of just a self-discipline thing of just keeping yourself from doing stuff. And even that part is a lot harder than I expected. I felt like I would be better able to keep myself from doing stuff that I maybe shouldn't be doing because I know that it's important and I'm trying to do that, but it really is so hard. It's so frustrating not being able to do stuff that it's very difficult not to just do it because it just seems like it's so much easier just to do it. And so it is a lot harder than I expected. As far as pain, it's kind of fluctuated a little bit. Sometimes I will go several hours without really any pain at all, and then sometimes I'll have more pain for a little while. Most of the time, I don't really have any constant pain or really anything that's really persistent. It's mostly, I'll get these little twinges of pain in certain areas that will kind of just come and go. And also if I move a certain way, then I'll get these little bits of pain. But I don't have any constant pain or anything that's really long lasting for the most part. I guess there's kind of a low kind of dull pain, ache kind of thing somewhat there, but I've kind of gotten used to that. It's kind of almost this white noise kind of in the background level of pain. But as far as acute pain that I actually feel as pain, it's mostly, like I said, just these little twinges or these little shooting pains that I get in different areas kind of coming and going. The bigger problem that I've had for the last several days has been itching and irritation from the bandages that I was using. I had a little bit of irritation on the Steri-strips. That part wasn't too much, but the biggest irritation that I've had recently is the bandages that I was using for covering my nipple dressings are these Telfa adhesive dressings, which in theory should have been really good because I had no problem with them at first. For the first several days I used them. I actually used these same things when I had my biopsy several weeks ago, and I had no problem then either, but just all of a sudden the last few days I have had a lot of redness and like irritation from it, and you'll see that when I show you my chest. Like, I didn't even use the adhesive on these yesterday, but it's still just there. Like, it's there from the last few days, so you'll be able to see that. But the reason that I chose these as opposed to regular Band-Aids was because the Telfa pad part of it is that it has like this extra film over the padding part of the dressing that protects from like open wounds and stuff, like from sticking, which it turns out I don't really need for this because I already have the zero form over the nipple graft, but it just seemed like it would be better to have something like that as opposed to just plain gauze, but I guess it ended up not really mattering. But that's one of the reasons I chose this. The other main reason I chose these is because they only have adhesive on the side edges. They don't have anything on the top or bottom. And so I thought that would be better for putting there because I didn't want there to be any adhesive going like directly over my incisions or like right around that area. And then like when I pull it off, be like pulling at the incision. So in theory, these would have been perfect and they were really great for a few days, but I think maybe just the fact that I was using them in the same area over and over again, my skin just really didn't like that. Or maybe it was the fact that I had it like in the same area and then also had it completely covered with the ace bandage and then clothes over it and everything. So it's like there's no airflow and there's no like real break for my skin. I don't know. But anyway, these worked really well at first. So if you don't have really sensitive skin, I do recommend these. I got them on Amazon, but they just, I don't know, I just suddenly have a reaction to them. So I actually ordered some other tape that I'm going to be using, possibly with these same pads, just without the adhesive part exposed, but I might just use plain gauze. I don't know yet, but it's supposed to be really good for sensitive skin. And then I also ordered some of these wipes that you basically like wipe over the skin where you're going to be putting tape or bandages or whatever, and it creates like kind of a barrier that the tape sticks to that instead of directly to your skin, so your skin doesn't get as irritated. So those are supposed to be coming today, hopefully very soon, so I can use them today, but if not, I'll have to wait till tomorrow, I guess. But anyway, that's been really irritating, literally, and I haven't seen a whole lot of other people talk about that. Whenever I watch other people's post-op videos, they don't seem to have all this like redness and irritation like I do, so I guess I just have really sensitive skin. But yeah. Other than that, I've just been kind of like lower energy than normal and just needing to sleep a lot more and just needing to rest a lot more and just kind of trying to take it easy, which is also kind of frustrating because there's a lot of stuff that I wish that I could be doing. But I am trying to get caught up on some things like editing my pictures from DragonCon that have taken me like 2 months to get to. And hopefully I'll have some time to edit some of my other videos that I've been planning to edit for like months. But other than that, like I haven't really been able to do a whole lot. I can't go anywhere yet on my own. I have to have somebody drive me, and I can't really do a whole lot else around the house other than like sit at the computer and do stuff. So I'm doing okay, but it's just a little bit frustrating. I'm getting a little bit restless, but I feel like I'm being productive enough on the computer doing stuff that I've been wanting to do for a while that's kind of keeping a little bit of that at bay. So that's good. But I do feel more tired than usual and just kind of like lower energy, which makes sense because I'm recovering from surgery and like obviously a lot of my energy is going toward that. So I'll go ahead and show you my chest now, and just to warn you, this is going to show my incisions and my nipple grafts as they look right now. So if that kind of thing bothers you, you might want to look away. I will come back afterward and like tell you when that stuff is not on the screen anymore so you can know it's safe to look back. So here's what my chest is looking like now, and hopefully this is in focus. I have to use manual focus on my camera, so I can't entirely tell if it's exactly in focus or not, but hopefully you can see well enough. And you can see also this irritation that I've had from the bandages that I've been using over the nipple grafts, and some of the adhesive and everything that's still kind of stuck there from the stair strips and everything like that. I've tried to get as much as I can off, but obviously I can't scrub too much right now. The incisions are looking pretty good. I was kind of nervous when I first took the stair strips off. For one thing, because they were really hard to get off. They really hadn't fallen off very much on their own, and so I had to pull them off. And I had to pull pretty hard. I obviously did it very slowly and very gently, but it still was very difficult. And I actually had like a square right here that I left. I took most of them off yesterday, but I left this little part right here until today, and it was really hard to get off. So this part especially still looks kind of red and everything from that. But overall, they're looking pretty good, and there is some puckering there, especially in the middle section here, and then on the ends here, it's almost like a dog ear kind of thing going on here, which I'm hoping is going to smooth out over time as it continues to heal, so I'm not too worried about it yet. But the incisions are actually a lot thinner looking than I expected. I thought there was going to be sort of more width to them, and that the like sutures and everything would be more visible, but it really doesn't look too bad. I think once it heals and once this like extra irritation around where the stair strips were and everything like that goes away, I think that they're going to look really good. The nipple grafts are also looking pretty good, especially the edges I think are blending in really well with my skin. The centers are darker, and that's the only part that really looks kind of scabby looking so far. I don't know if I'm just slower to get to that point with the rest of them, but I still have a couple weeks left of doing nipple dressings and everything, so I think there's still quite a bit of healing that's going to happen within the next couple of weeks. Overall, I'm really happy with the shape of everything and the contouring and everything like that. I think it's going to heal up really well once I get through these next few weeks especially. So there you go, that's my chest 2 weeks post-op. Okay, so we're back to me talking normally now. No more pictures of my chest, so you can look back if you had looked away before. After I took my stair strips off yesterday, I got really anxious about it. I started kind of panicking and like wondering if maybe I shouldn't have done it, because I felt like the incisions, I guess I expected them to look a little bit more scarred. I guess based on some of the other people's like 2-week post-op videos and pictures that I've seen, I expected the incisions to look more, I don't know, like further along in the healing process. I don't know, mine for some reason to me, they look like the skin is like barely fused together. And so I was just kind of concerned, especially in a few different spots. I was just kind of concerned that like putting the ace bandage directly over it would like pull at the skin too much or like be too abrasive or something like that. So I kind of was like freaking out and didn't know what to do. So Jason helped me call Dr. Garramone's office because I was like too kind of panicked to call myself. Not really panicked, but I was just kind of like really overwhelmed. And when I get like that and when I start getting to the point where I'm like almost like crying, I feel really embarrassed to talk to anybody because I feel like I get really like whiny sounding and just like, I don't know, I just hate how I sound at that point. So I was really embarrassed to even call the office, but, and then even more kind of embarrassed to have Jason have to help me. But anyway, I'm sure that that's not the only time that that's happened. I'm sure other people have called the office and have to have other people call for them and stuff, with silly questions after surgery, but I just felt kind of silly about it. But I did talk to Dr. Garramone for just a minute, and he reassured me that it was fine to have the ace bandage directly over the incisions and that it, like I didn't have anything to worry about. So that made me feel a little better. So that's what I did. So I think that's pretty much it for this video. As always, if you have any questions, you can leave them in the comments or message me or however you want to get in touch with me. And if you like this video, give it a thumbs up and subscribe to see more of my future content. Thanks so much for watching, and I'll see you guys next time.